the Jedi Podcast. I'm Jessica Barraza. Today brings us to the end of the week-long national focus upon Black maternal health and the driving factors behind the inequities that exist around this important issue. In part one of this podcast, we talked to Gina Johnson, Medical Director of Pediatrics here at NEVHC. Today we are joined by another of our esteemed providers, award-winning nurse practitioner Brittani Clark. Welcome to the podcast, Brittani.
Thank you so much for having me.
This year marks only the 6th annual observance of Black Maternal Health Week according to the Black Mamas Matter Alliance. However, it is an issue as old as the nation itself. Can you help us understand what is behind the persistence of this specific inequality in healthcare?
Yes, so a lot of inequalities, racism, bias exist in our nation, exist in the country, and it extends into healthcare. And because they extend into healthcare from our nation, it affects the communities that our Black mothers live in.
The theme of this year's focus upon Black Maternal Health Week is Our Bodies Belong to Us, restoring Black autonomy and joy. In the light of the rising rates of maternal mortality in Black women, where do you think we can find strength in this message?
I love this theme. The biggest strength in this message is empowerment. Empowering our Black mothers to advocate for themselves in their health care when they're going to perinatal, prenatal, postpartum visits, when they're in the hospital delivering. It's really important that they know and are empowered to advocate for themselves, that they feel empowered to ask questions about what's going on with their bodies, about what's going on in their health care, and how everything is working together for them.
You're right, Brittani. Empowerment is so important. In our clinics, we have a sharp focus upon ensuring excellent patient outcomes for all of the communities that we serve. As a provider, what do you think that we can do to ensure that we keep the disparities of Black maternal health in the focus of our minds, and that we are taking the necessary steps to break down the statistics, which show, for an example, that Black women have a maternal death rate that is 2.6 times higher than for white women?
So first, it's really important that we provide education for all healthcare workers to make sure that we know what the biases are out there and what the disparities are, and do that by providing continuous training for healthcare workers. Then the second step, as a healthcare worker, it's really important that we check our bias first, because everyone has some type of bias. So before going into a room, making sure that we're checking that bias at the door. Third, it's really listening to what our Black mothers are saying, what their experience is, from what they're feeling physically to what they're feeling emotionally, mentally, what their experience is socioeconomically. Everything adds up and is part of their experience. It's really important that we're hearing them, that we're partnering with them, and providing the services outside of the healthcare system to help them along this journey. It also is important to help empower them and listen to them when they say they're in pain, when they're feeling anything that might be happening, so that we are bettering their experience. The last thing that maybe we can do is go outside of the four walls of the doctor's office and get education into the communities, like meeting the patients where they are, whether they're in churches, whether they're community centers, schools, getting that education out there for the mothers to meet them where they are, because they may not be able to get to the healthcare center.
That's a really good point about looking outside the clinic to provide support. My final question to you is, are there any resources to which we could direct our listening audience to either help them better understand the issue of Black maternal health, or get involved in the battle of bringing down the numbers and help us reach equity on this critical matter?
There are a few resources available. One is that you mentioned, Black Mamas Matters Alliance. They have a lot of educational resources on their website. There's issue briefs, reports, publications that help to educate people on this important issue and also to help close the gap. Every Mother Matters, or Every Mother Counts, is also a website that's available for a lot of resources, reading material and education material. And finally, Miriam Perez did a TED Talk on racism and how it affects pregnancy. And it specifically talks about how racism affects pregnancy in Black women. She gives a lot of educational points and brings awareness to this important issue, but she also gives some resolutions to help to close this gap and make things better for Black mothers.
Brittani Clark, thank you so much for joining us today.
Thank you so much for having me.
We would like to thank our listening audience for joining us today. We would love to hear from you on all Jedi things. If you have show ideas, please reach out to us at jedipodcast@nvhc.org.